A 72-year-old man comes to the physician for constipation. He has a history of hemorrhoids and suspects a recurrence. The patient feels no pain during defecation. After endoscopy reveals an irregularly shaped mass in the inferior rectum, the physician performs a biopsy, revealing an adenocarcinoma. Which of the following lymph nodes is this cancer most likely to spread to first? Choice A, superficial inguinal. Choice B, external iliac. Choice C, internal iliac. Choice D, para-aortic. Or choice E, inferior mesenteric. I'll wait 5 seconds and answer the question. Lymph node drainage is a fairly popular question. In my experience, the areas that they like to ask about most are the pelvic cavity and the chest, especially breast cancer. They really like asking about breast cancer. Now, as far as this question goes, you have a mass in the inferior rectum, just give it to you outright, and it's further emphasized by the fact that he feels no pain during defecation, which implies that this is something happening above the pectinate line. Generally speaking, the middle and inferior rectum drain into the internal iliac lymph nodes, so choice C is the correct answer. Now, questions like this pretty much are hard memorization a lot of the time. But for the pelvic lymph nodes in particular, I feel like there's kind of an intuitive aspect to it where even if you forget some of it, you can sometimes make a pretty good guess. But let's just look at the wrong answer choices first, and we can kind of see a pattern emerging here, okay? So choice A, superficial inguinal. The superficial inguinal nodes drain from the distal vagina, vulva, scrotum, urethra, anal canal below the pectinate line, and skin below the umbilicus. Now this one's actually pretty easy because if you look over what you have here, very in accordance with the name of the node, superficial inguinal, these structures are also very superficial. I mean, look at it. Vulva, scrotum, urethra, and anal canal below the pectinate line. These are all pretty much your external genitalia, right? The only one that I think might throw some people off is the distal vagina, which some people might say, well, isn't that kind of an internal structure? And it sort of is, but only in the same way that the anal canal also is, right? So, as a general rule, if you ever get a question talking about the external genitalia or just the skin in the perineum or the anus, and they ask you about the lymphatic drainage, you just got to think about superficial inguinal. Very intuitive, I feel like. Choice B, external iliac nodes. These drain the body of the uterus, the cervix, and the superior bladder. Now, here's the way I would look at it. If you look at the structures for internal iliac lymph nodes and the external iliac lymph nodes, do you notice how the external iliac nodes drain stuff that are superior to the internal iliac lymph node drainage? Other thing to note is that a lot of these structures are midline structures, right? They're more medial. You got the cervix, the proximal vagina, corpus cavernosum, which is pretty much a penile structure, the prostate, and the inferior bladder, all going to the internal iliac lymph nodes, and then the external iliac nodes are right above that with the superior bladder and the cervix and the uterus. And then again, you want to contrast that with choice D, para-aortic nodes, which kind of drain a lot of the structures that come in pairs. Para-aortic nodes drain the testes, the ovaries, the kidneys, fallopian tubes. So you can be thinking that the para-aortic nodes drain stuff that's more lateral to the iliac nodes. And then finally, we have choice E here, inferior mesenteric nodes, which drains in a similar fashion to the venous system, right? It drains from the colon, from starting from the splenic flexure to the upper rectum, which is actually relevant in this case because this question specified the lower rectum. So if this patient instead had a cancer growing in the upper rectum, choice E might be the correct answer here instead. So bring it back. Lymph node drainage is fairly high yield, especially like I said in the pelvic cavity. It's just a really dense area with a lot of different organs, especially reproductive organs. So once again, you want to know superficial structures, as the name implies, are drained largely into the superficial inguinal nodes. And then you want to draw another line basically halfway through the bladder, where below it you have the internal iliac lymph nodes draining the cervix, proximal vagina, prostate, inferior bladder, and lower rectum. Right above it, you have the cervix, uterus, and superior bladder draining into the external iliac nodes. And then you have the paired structures, such as the testes and ovaries and kidneys, fallopian tubes draining into para-aortic nodes. And finally, for the rectum specifically, you do want to know that the upper rectum tends to drain into the inferior mesenteric nodes. Like I said, you can hard memorize this stuff if you want, and that will guarantee you getting questions right. But there's also kind of a general intuitive reasoning way of doing it, which can get you probably like 70% of questions right, I feel like. So it's up to you what you want to emphasize. I hope you found this video helpful. I'll see you in the next one.